Hello, everyone. This is Ann Cuppinger from the Managed Care Technical Assistance Center, and I want to welcome you to today's webinar on the HCBS Level of Care Eligibility Determination. You will, if you're interested in having a copy of the slides to look at during the webinar, you can look in the chat box and you'll see a link for those slides. They were also recently sent out over the DOH Health Home listserv. The reason we're mentioning this is that there are some links in those slides that will lead you to some of the forms that are going to be discussed by the presenters. So in order to see that chat box, what you want to do is, you should see it on the right-hand side of your screen. If you don't see it, look at the bottom of your screen and hover your mouse over the bottom of the screen, and you'll see an icon that looks like a speech bubble. If you click on that, the chat box will open up to your right. We'd also encourage you to chat into the chat box if you have any questions throughout the webinar. We'll be gathering those questions up, and if time allows, answering them at the end of the webinar. If time is short, or if we have a number of questions that we're not able to get to, within a few days, you'll find that the slides from today's presentation, as well as the Q&A document, will be posted to our website at mctac.org. If you look under upcoming events, then you'll see a calendar, and you look under today's date, you'll find the slides and related Q&A documents from today's presentation. I just want to remind everyone that the information contained in today's presentation is current as of today, and that we encourage you to stay tuned for any updates and official documents and information that will be released by the presenters. If you have additional questions, the presenters always encourage you to contact them through the appropriate mailbox. So without further ado, I'm going to turn this over to our state partners, and we'll get started with today's webinar. Thank you.
Good afternoon, everyone. This is Colette Pullen with the Department of Health for Health Homes Serving Children and for the behavioral health transition. And I know that we have a number of other state partners that are on the call that will be assisting us as we move forward to the questions. So just a couple level setting things that we want to make sure, and thank you, Ann. Ann gave you a lot of information about the link, and you should have these slides through the Health Home listserv. We sent that around, as well as here in the webinar chat box, so that you have that information. We're not going to go over the specific forms, but the forms are at the end of the slide deck in a list, and they link to our website so that you would have that information ahead of time for your assistance. And on March 13th, we did an overview of the HCBS Level of Care Eligibility Determination, and there was quite a bit of confusion and some level setting that we needed to do. So this is our review of that, and we got a lot of feedback that a step-by-step process would be helpful, and so we tried to break this down so it's more manageable. You could, when you have the slide decks printed, you could use it as a reference tool as you move forward for eligibility. So we hope that this webinar and the tool are helpful to you. So as I'm sure you are all aware, our new children's waiver began on April 1st, and the new HCBS LOC Eligibility Determination, that's actually the name of the tool, is in our uniform assessment system. And again, our purpose today is to kind of do like a retraining of the process for HCBS. We know that each of the waivers that ended and merged to this consolidated children's waiver had their own individual processes to determine that someone was eligible for HCBS. So we want to make sure that everyone's aware that this new children's waiver supersedes all those processes and that these are the new processes for the new children's waiver as we move forward. And additionally, since the launch of April 1st, we did restrict to close down our HCBS eligibility determination within the UAS. So we want to make sure that you're all aware of why that was closed. So as I mentioned, there was a number of determinations that were done literally within April 1st, April 2nd, and they were done incomplete or incorrectly. So throughout the first week of April, we had over 30 assessments. Many of them were entered incorrectly. We called those providers and had discussions, and it seemed like folks were a bit confused. All of these assessments, the 30 of them, have been removed from the system because we don't want not only bad data, but we did not want children and families to get notified that they were or were not eligible for HCBS if that was incorrect. And again, providers have reached out to the state saying that they were confused or they needed additional guidance so that they would complete the determination correctly. We also had an issue with some of the programming through the target population of developmental disability and medically frail. So with some of those assessments that were completed, one of the errors were based on that programming error. So we had to address that. And then lastly, there were not the required forms or documents for all the components, and so providers were asking how to move forward. It's really important that we all understand that now that we have this combined children's waiver, our goal is to expand the number of providers that are able to conduct HCBS eligibility, and that there's no wrong door, again, because we're consolidating the 6 waivers into one, that a child or a family can go to a mental health clinic or go to their DDRO's office or go to a health home care management agency, regardless of their diagnosis or their concerns or issues that they want to have addressed. And an HCBS eligibility determination can be made if they so want to see if they're eligible for those services, and that they now have an expanded array of eligible services that they could access if they are found eligible. But this is an awesome responsibility now on care managers and CS and our DDROs, because you are doing processes that we've heard from all of you that sometimes in the old waivers may have taken some time, or it was a lengthy process, there was a lack of communication. And again, this is not over every waiver, but you know, these are the types of things that we're trying to address. And so it's really behooving upon all the care managers that you understand this process. This is a Medicaid program, and you're determining whether or not a child is eligible or not eligible for waiver services. These are auditable services. We have performance measures with CMS to ensure that the correct children are receiving the services and that proper notice is given to families. So we were, you know, concerned with our launch that we didn't have all our ducks in a row and that providers were still struggling. And, you know, we appreciate all the hard work everyone has been doing just to manage the transition. And I think we weren't all prepared for that April 1st. So I think this has given us some time to finalize the transition of the children that we need to. We're really wrapping that up right now, and that we can now all focus on how to move forward within the children's waiver. So it's really important, and we thought this would be a good time to have this retraining and make sure that everyone understood how to move forward. And as I mentioned, we did get feedback from some providers and health homes, and we tried to restructure this webinar so it would be more useful to you as you move forward. So we do hope that this is helpful for you to move forward with the eligibility determination. And of course, at any time, you know, as you're moving forward in the weeks and days to come, if you have concerns or questions, please reach out to DOH or your state partners. And then also we'll be talking and educating our lead health homes so that they can assist any provider that has questions. So as I mentioned, you all are aware, we have combined or consolidated these 6 waivers, and so any of the waiver providers that were associated with these waivers have moved into health home care management. And now as a health home care manager, you are able to complete the HCBS LOC Eligibility Determination, where in the past, maybe your local SPOA or the Department of Health or OPWD or other processes were in place. So this is our attempt to streamline some of those processes. And again, it's to make sure that we can get to those one set of services in a timely manner, and that there's no wrong door, and that there's one process for families to move forward through the process. And so that is our goal. And as I hope you all know, is that a child who is eligible for HCBS is automatically eligible for health home and does not need to prove health home eligibility and appropriateness in conjunction with HCBS. So if you're HCBS eligible, you're health home eligible. However, the children that are currently in health home are not automatically HCBS eligible. They would need to go through the HCBS LOC Eligibility Determination. So we have had a lot of questions about that regarding the children who are already in health home. Can they receive HCBS services? So that is a possibility, but they first need to be determined HCBS eligible and meet the level of care requirement. And also it's important for folks to understand that if you are receiving health home due to your HCBS eligibility, that if you are no longer eligible for HCBS, you would then lose your health home care management unless you are separately found health home eligible and appropriate. So this is a natural fit, we think, to do a step down. So kids with high needs that meet HCBS eligibility, and then they start to do better, they have connections to the appropriate services, and they may no longer want HCBS, or they may no longer meet eligibility, then hopefully they would want to step down to just health home only, and they can remain with their health home care manager, because once again, the HCBS determination is made by health home care managers. So care managers will eventually have a mixed caseload of children who are HCBS only, health home only, or HCBS and receiving health home. Additionally, we want to make sure that people understand the purpose of HCBS. There is, I like to say, a higher bar to reach with level of care. And the purpose of HCBS is really to assist children and families to be able to stay in their own home and in their own community safely. So those children that are at risk of being removed or put in a placement, a nursing home, a residential facility, we want to give these HCBS services when they meet eligibility to prevent that higher level of care to occur. And for those children who unfortunately are already hospitalized in a nursing home or a residential facility, then we want to be able to provide the services within their community and around their home environment so that they can safely return to their home maybe quicker. Some children may need that higher level of care for a period of time, but we do want to make sure that we get children to be living within their home and their community in a safe way. And additionally, based on the consolidated waiver, then we also expanded the array of services and really want to track the outcomes for children, that these services are assisting them in decreasing institutional placement and increasing healthier outcomes for children. Now, before we start going through the process for HCBS eligibility, it's really important for those of you who were previous waiver providers or have a transitioning waiver child, that they were, which means that they were already previously in one of those 6 waivers, and during the month of January through, I'll say, April, because we're still transitioning some children now in April, that they were counted as a transitioning child. So they moved from one of the 6 waivers into health home, or if they opted out, they went to CS. And so this is important to note that you must have an annual LOC, a level of care. This must be done every year. This is not a change from the other 6 waivers. It's a requirement of CMS that if you're in a 1915C HCBS waiver, that you must have an annual recertification or determination. And so for transitioning children, if you have a recertification or annual determination that is due between April 2019 and next year of March 31st of 2020, then if the child is found not to be eligible for HCBS, then we need to talk. So you need to contact capacity management. Right there is our email address, and talk about the child who is not eligible. We have a mandate through the federal government to ensure that any transitioning child does not lose HCBS services, because the state of New York determined that we were going to change the process, right, and establish this new children's waiver. So prior to sending out any notice of decision or telling a family that their child is no longer eligible for waiver, you will be contacting us, we will be reaching out to you, and we will be determining whether or not that child would be eligible through their old waiver process. If they're, especially if they are going to be hospitalized or at risk of placement. So we want to have that discussion as soon as possible once your eligibility is determined, and then we will let you know whether or not that child is eligible from the old process. So this is very important for all transitioning children. This process will end come April 1st, 2020, because then every transitioning child would at least have one annual recertification redetermination that has already occurred. So that's really important for folks to understand that, because as I mentioned, we did have some assessments that were done that first week in April on transitioning kids, and some children were found not eligible, and we had some confusion with some families, and we don't want that to happen. So let's talk a little bit about the pathways to HCBS and to receive level of care. So children who are already enrolled in Medicaid and who are believed to be HCBS eligible, or they're in need of HCBS, will first of all be referred to health home. They can always opt out of health home at any time, and we can talk about that a little bit more. But those who are not enrolled in Medicaid and they're believed to want or need HCBS, then they need to be sent to our independent entity of the Children and Youth Evaluation Services, which is called CES. Health Home Care Managers, or CES, will work with the child and family and providers to determine HCBS eligibility. So this is important to know that you can't do this by yourself. You're going to need documentation, you're going to need input from the child and the family, as well as any providers that are involved. Many of the processes include diagnoses or involving a licensed professional. So you will have to be in interaction with folks. You can't just sit at your desk and do this HCBS eligibility determination. And the HCBS is available to all children under the age of 21. So once a child turns the age of 21, then they are no longer eligible for the Children's Waiver HCBS. And there's no exclusion group. So we know that different populations of waivers previously excluded different populations, and that is not the case here. So if it's a child under the age of 21 who is believed to be in need of HCBS or eligible for HCBS, then you can conduct that determination with them. And then, as you all know, this determination is housed in our UAS system, which also houses our CANs. Those tools are linked together within the UAS. And again, the awesome responsibility of making this determination falls on our health home care managers, CES assessors, and then as well as our DDROs. So getting to pathways, so we have children clearly that are already enrolled in health home today, and it's incumbent upon the health home care manager to really have a discussion with the child and family. As we said before, every child in health home would not be appropriate for HCBS. And you don't want to do this determination on every child and just go through the process. That's not, I think, a good use of your time. Or for the family, it's really a discussion on what are the services, what are the needs of the child. So you're going to look at your CANs, you're going to look at your comprehensive assessment, you're going to look at the services the child is already in and how they're being delivered. Are they meeting all the needs of the child? And remember the purpose of HCBS. If the child has medical, behavioral health issues, are they at risk of going into a placement or a residential care? Is your child in and out of the hospital already today? So you really need to think in consideration that you need to talk with the family, you need to know what's happening already for them, and talk with the providers that are involved and talk about the child's needs and whether or not HCBS would be even a benefit. If the child has a number of services, would these added services be more of assistance or more of a barrier if there's more programming? Or are there different services that are needed? You had this child in these services, but they're not really meeting the needs, and you think the array of HCBS services may accommodate and meet the needs of the child. We also presented this Children's HCBS Planning and Plan of Care webinar, and the link is there. And in that webinar, OMH and OPWDD and other folks I give you example questions that you should ask yourself or your family on seeing how you might want to get to HCBS. So it's important to have that dialogue. And of course, you always have to discuss this with the family. If the family is not interested in HCBS or they don't want to feel like they need that or want to go into HCBS services, then you do have to honor their choice of that. So you want to have that discussion. And again, a requirement of the health home program is when you're reviewing the plan of care, updating your CANs in New York, that you should have a multidisciplinary team. And I think this would be absolutely the perfect time to have this discussion, to notify the multidisciplinary team, which includes the child and the family, explaining the new children's waiver, what it has to offer, the services available, so that together as a group, you can discuss what are the options and what may be the best course of action with the family input right there to determine how you should move forward. So, of course, any child in the health home program can be considered for HCBS, and depending on how long they've been in health home, you probably have an answer to a number of these questions already since you've been working with them. So another pathway is HCBS eligibility determination is pursued because you have a child that has high needs. And again, it goes back to the purpose of HCBS. So you want, you had maybe some inpatient stays. They're going to be discharged, some discharge referrals where hospitals and residential placements are saying we think we can have this child return home with a variety of services or HCBS interventions. So this is the new referral that comes to you, and again, talking about when and how this child would be appropriate for HCBS. So if your agency works with a number of children on different programs, then these are the types of things that they should be considering as they move forward, and whether or not they're discussing making a referral to the health home care manager for a determination of HCBS. Whether they're on Medicaid or not Medicaid, you want to have these 3 bullets are kind of a consideration on what you should think about for any new kid that your agency or community comes in contact with and they're thinking about needing an HCBS referral or determination made. If a new referral is made to the health home, then again, you need to, have that assessment or that review with the family. You're looking at, when you're enrolling a child in the health home program, you're already gathering information from providers to determine whether or not the child meets health home eligibility. You're getting their diagnosis or their chronic conditions. You're talking with folks about whether or not they meet the appropriateness criteria. This is going to start to give you a good sense whether or not a child may need HCBS. And of course, you're going to be doing your CANs and your comprehensive assessment. So at any time of a new referral, you can be having these discussions. And again, thinking about those questions that have been in a previous webinar. What type of services a child may need, what are their needs, what will be helpful to them. So these are the things you want to think about because, again, we only have so many slots for children, and we want those children who will be eligible for HCBS and benefit from HCBS to receive the determination. So that's important to proceed, but you want to really do this with the family, with the other providers involved, and make a decision based on the needs of the child and what services they do or do not already have, as well as keeping the purpose of HCBS in the forefront, that we really want to prevent higher levels of care or to make sure that children are able to return to their community because they are already placed at a higher level of care. And then, of course, I cannot stress enough that this discussion needs to happen with the family and the child. If the child is age appropriate to have this discussion on whether or not they would like to pursue HCBS eligibility, that decision cannot be made alone by the care manager. So you want to have that discussion. You want to be familiar with the services. You want to be able to talk about the child's needs and what services you think may be beneficial for you to be able to pursue HCBS. And again, any provider that's already involved with the family, having that multidisciplinary team meeting and discussing the needs and having different opinions from providers who have already worked with the family, especially if this is a new referral. You may not know the child as well as some of these other professionals, and so that you can get assistance on how to move forward, and even with talking to the family based on the services they have already provided or the things that they've been working with the family on. And so I've mentioned this a couple of times already, but it does have to be the child and the family choice for HCBS. So it is absolutely necessary that the health home care manager or CES, who's working with everyone, has a discussion with the family and the child and gets that they want to pursue HCBS, and you will need to be documenting that in a note in the case file. So it's important as you move forward in trying to pursue HCBS that discussion has happened with the family, the benefits of HCBS, their needs, their plan of care has been reviewed if there's one already in place, the services, so that you get the okay from that family to pursue that. The other thing that we didn't really mention yet is you should always be looking at the services that are available, our state plan services of children and family treatment support services and other Medicaid services prior to conducting the HCBS. Again, we want to get children in the right services at the right time. So not every child is appropriate for HCBS, but not every child is also appropriate for CFTSS. It's really important that you know what the various services are, what needs they can meet, and then be able to present that to the family so that you're linking the child with the right services at the right time. So we're going to go through the tool, and we hope to have broken this down kind of more of a step-by-step process. So some of the slides will clearly be duplicative for you from the last webinar or a refresher. So we hope that's helpful, and then others will be a walk through the process. So again, our HCBS eligibility determination is part of a collaborative process. I feel like I've said that enough already, that it's with the child and family that you're obtaining the necessary information and documentation to determine HCBS. So this is after you've done that, that review of the current services that they're involved. You've talked to the providers. You've talked to the children and the child and the family. You've talked about their needs and how HCBS may be beneficial to them. And everyone's kind of on the same page saying, yeah, we think HCBS would be appropriate. Then you would start to pursue HCBS eligibility determination. And as we mentioned previously, this determination in the system, right, in the UAS system is a decision tree type instrument, meaning one section must be completed with specific conditions met before the assessor can move on to the next section of the tool. What I will say to you is there's no need really to go in and out of the tool, that once you learn the steps and you know the documentation that is required, then a care manager or CES can go about their business obtaining all that information and that documentation, and then going into the UAS one or two times, and then going through the process of documenting in there the appropriate choices based on the documentation you have received. And the UAS does not upload any documents or anything like that. So literally you are reporting by clicking radio buttons what you have and what you do not have. So the record keeping or the case file is really with your health home. In your health home system, however they keep those records. So all that documentation that you gather will go there. If there's copies or information that needs to go elsewhere, we have articulated that in the slide. And there's three components that every child must meet to become HCBS eligible. The first is the target population. So you need to meet target population. You have to have the required documentation for target population before you really can move forward. Then there's risk factors, and then there's the functional criteria. Because many times people can have diagnoses or conditions, but they may not actually impact their daily living or how they're functioning. So functioning criteria is especially important as we move forward as the third leg of the stool to finalize eligibility. There are 4 target populations, and once again, remember we took the populations that were already being served by our 6 waivers that made the consolidated children's waiver. So we have our SED population. So we had an OMH SED waiver, and OCFS Bridges to Health also had SED. So now both of those populations are just called SED, so it's one target population. Again, remember, there's no wrong door here, so whether you were previously an OCFS versus an OMH type kid, it does not matter. It really is about the diagnosis of SED. Then we have our medically frail children, and again, we had our DOH 1 and 2 waiver that served this population of children. OCFS also had a medically frail population. So again, this is now one doorway for these children. Then we have our DD MedFrag, which used to be our OPWDD Care at Home 4 waiver, I think was the various names. And our DD foster care, which used to be a Bridges to Health waiver. Those two populations of DD will be conducted, the eligibility determination will be conducted only by the DDRO. So children may be eligible for more than one target population, so they may be eligible for one or more, but you only need to pursue one. The health home care manager must decide which target population they're going to pursue upon the diagnosis and provide the information before that referred child. So once again, once you learn what is needed for the different target populations, the risk factors and the functional criteria, you would be better equipped on how you're going to move forward through the actual tool. So it's important that you learn that information that you'll need, because that will assist you in maneuvering through the UAS to complete the eligibility determination. So should the care manager and CS believe that the child may be eligible through a different target population due to multiple conditions, diagnosis, complex needs, then they can go through the eligibility tool more than once. So if they are found not eligible under one target population, you can go through another target population if you have the proper documentation. So again, you really need to learn the information you need to gather, the people you need to talk to, because it is a process. So you won't be able to necessarily go through the SED target population if you find the child's not eligible and then go through the MedFrag. You probably can't do that in one day. You would need the documentation, and we're going to go through those steps. But either way, if you choose to pursue one right after another, there will only be one notice of decision sent to the family. So if they are then found eligible, you'll send that notice of decision that they're eligible. But if they're found, again, not to be eligible, then you're going to send that notification that they are not eligible. And just some general rules. As I said, you can't sit at your desk and do HCBS eligibility. There has to be a face-to-face contact with the child and family to do this determination. There has to be documentation that there was a face-to-face. And again, that's because families have choice. And we'll go through a form later in the slide deck that talks about how the family and the child need to sign off on what's called the freedom of choice. So not only do you have to get their permission to pursue HCBS, but then you have to reconfirm that they're interested in receiving the services after they're determined eligible. As I already mentioned, our UAS holds our CANS tool for health home acuity, as well as the HCBS eligibility determination. The CANS tool is done or completed or needs to be completed every 6 months unless there's a significant life event. The HCBS eligibility tool needs to be done on a yearly basis unless there's a significant life event. So we know that these timelines won't sync up on a regular basis, but it's important that you know that each one has a timeline, and within the UAS system, there is a clock for each of those tools so that you know when the next one will be due. Each tool that once you redo their assessment, whether it's a significant life event reason or it's just at the 6 months, the 1 year, then the clock restarts. So that's really important for folks to understand that once you've completed the tool, the clock will restart. If there's a member who was previously determined HCBS eligible and they refuse or they're not interested, or they start HCBS services but then leave, and then they ask to return back to HCBS, they decided that they really wanted those services, then the HCBS LOC Eligibility Determination will need to be redone. If a child is not found eligible for HCBS, if there's ever a change in their circumstances or their condition, then the child, the family, providers, even the health home care manager can request that another HCBS eligibility assessment is conducted. There's no waiting period or time frame for this. We do know that children and families can be doing fine, and then a crisis or a situation could happen, or their condition or circumstances could change. So there is no wait period, but you want to make sure there is definitely a change, because otherwise you'll get the same outcome, that there's some different change within their circumstances or conditions. Here is the reasons why you would conduct what we say an earlier assessment, a reassessment prior to the 1 year. So we also have a similar list, it's not the exact same list for the CANS New York. We are going to be hopefully posting a document on when these reasons should be used by explaining these, because we have had a number of questions from providers that if a child's admitted to a hospital, gets out of a hospital, then goes back into the hospital several times within the first couple months, when do we do this reassessment? So we will be giving some guidance around that. And again, I think I've mentioned this, but it's incumbent upon the person that is doing the HCBS eligibility determination, so our health home care managers or CS, obtaining all the documentation that verifies the individual meets the requirements of the target population, the risk factors, and the functional criteria, unless it's those two populations that the DDRO. But you, as the health home care manager or CS, are still required to have that documentation and ensure that that documentation is in the case file for that member. Also, that diagnosis alone is not sufficient to meet target population. So we want to make sure that as we go through the various target populations, you understand that a diagnosis alone does not necessarily meet the target population, and that you need particular documentation from a licensed professional. And again, it's the responsibility of the health home care manager and the CS staff to make sure all that documentation is in the record. And also that providers who are assisting you with providing that documentation, that you're educating them on what you need and why you need it, so that they can help you, because again, we haven't trained every single professional out there that works with children and families, so it's important that you explain the appropriate documentation requirements that you have and that you are able to obtain that. So there will be several forms that you'll need to complete along with gathering the documentation to meet target, risk, and functional. And on an annual basis, as we mentioned, you will have to redetermine HCBS eligibility, and you will need to have current or updated documentation to meet that each time you do the annual reassessment for HCBS. And in the slides to come, when we go over the target population, then it will specify what type of documentation and how long it's good for. And again, that you will document all that in the record, and you'll assist providers to assist you. And again, the last piece really is that it's not the role or the function of the health home care manager or CES to make any determination throughout the process. You're not determining if somebody meets SED. You're not determining if somebody has a disability. You are collecting the information to verify that these diagnoses and other determinations have been made by the appropriate licensed professional. So target population looks like this within the UAS, where I list all 4 target populations, and then we're going to talk about SED. So you would select SED, and let's talk first about SED. So to meet target population for SED, you need to meet all 3 criteria. So the first is, for all the populations, the child needs to be under the age of 21. Because that's the waiver, and that's the population the waiver serves. The other thing is that the child has to have a serious emotional disturbance. That means from the DSM, they need a mental illness diagnosis. And here's a list of those categories of diagnoses. So they need a diagnosis. This alone does not make them eligible for SED. The third prong of SED is that they have to experience a functional limitation due to the emotional disturbance over the past 12 months on a continuous or intermittent basis as determined by the licensed mental health professional. And outlined here are the 4 areas in which they need to be assessed on whether or not they meet this functional limitation, either moderately or severely. So a child presents to you and they have a mental health diagnosis of depression. Then maybe they're seeing a therapist or they're at a mental health clinic. That alone does not meet target population. You would need a psychological assessment or some other assessment that has assessed for these functional limitations, but that alone also does not get you to SED. You would need the licensed mental health professional to say that the child has been determined to have SED. Again, it was the responsibility of the health home care manager and CES to be responsible for requesting and acquiring the documentation from the licensed mental health practitioner. This, and here's a list of potential assessments that may be relevant for you to obtain for the target population that would show that they have a mental health diagnosis. And as I mentioned, they need to articulate that the child meets the SED criteria. If you don't have that and you have a psychological, then it's your responsibility to talk to the licensed practitioner and discuss what is the criteria and for them to determine whether or not the child has met the SED diagnosis. For mental health and for SED, when you're conducting this annual determination for HCBS, you don't need a new mental health diagnosis. That mental health diagnosis does not need to be refreshed, but you still need to determine, the licensed professional still needs to determine on a yearly basis that the child continues to have that functional deficit that meets the SED definition. I just want to highlight that this is the exact same criteria for the single qualifying condition to meet the health home eligibility for the chronic conditions. So if you have this for the child in health home, or if you're receiving this documentation, gathering this documentation for HCBS, then it would also meet the health home eligibility. So now you have the HCBS eligibility target population, where you have the child under the age of 21, they have the appropriate mental health diagnosis, and the licensed mental health professional has determined that they meet SED and has actually determined that the child is SED. You have that documentation with you. You can now proceed to the risk factors. For SED target population, there are 2 risk factors that you need to go through. The first is a list of risk factor questions or criteria that you need to identify whether or not the child meets one of them. They're outlined in the next slide. And then the second portion is you need to have the licensed practitioner of the healing arts within their ability to diagnose, in their scope of practice, to review all the clinical documentation for SED, and then sign our LPHA form. Now, you just met with a licensed mental health professional to get that SED determination made, right? So that may be the same professional that may be able to assist you by signing your LPHA form. Does not mean that you necessarily now need to find a new professional, right? So again, it behooves you to know all of the things that you're going to need to acquire for the target, risk, and functional, so that when you're meeting with professionals or you're talking with them, you can get the required documentation that you need. So as I said, there's 2 risk factors requirements. The first is the child needs to meet one of these factors. The child is currently in an out-of-home placement, including a psychiatric hospital, or the child has been in an out-of-home placement, including a psychiatric hospital in the past 6 months. The child has applied for an out-of-home placement, including placement in a psychiatric hospital within the past 6 months, or the child currently is multi-system involved, 2 or more systems, and needs complex services supports to remain successfully in the community. So I had a provider ask the question, if the child doesn't meet one of these factors, are they able to move forward in the LOC process? And the answer would be no. This is one of the factors they need to meet. You will need to make sure that you have documentation to support your choice. The type of documentation that you could have is if the child's in an out-of-home placement, all the placements, residential, hospitals, psychiatric hospitals, they all have documentation that with a proper release will be able to share that information with you, right? And if they were in an out-of-placement previously in the past 6 months, there would be that type of documentation, and you would definitely want to have that placement on your release to find out the history of the child, so you will be able to gather that information. And then multi-system, we do have a definition there. You need to show that the child has complex needs. So maybe they're in the juvenile justice system, they're in the child welfare system, they're also have mental health, and they're at a mental health clinic. So there's a list of potential services there. If there's a child who's going to clinic and they're going somewhere else for mental health, that's not multi-system, that's multi-services. Right? So there's a difference between being in multiple services versus multiple systems for multiple needs. So you just want to make sure that you have documentation to support your selection. The next thing is you would need the LPHA attestation form. So we have that link right there to that form, 5275. We have a list of who are considered professionals for the LPHA to sign off. Each of the target populations are on that attestation. The directions are on the form. They will have to gather, or you will have to provide the target population information, the documentation, and they will need to attest that the child meets the meets the target population requirements, and that they are attesting to, without HCBS services, they are concerned that the child will be placed at a higher place. This attestation needs to be done on a yearly basis along with your HCBS eligibility determination. And we are going to have a help sheet that goes through each of the steps. Even though the directions are on there, we're going to explain who needs to complete what. But this form needs to be completed by the LPHA. They actually have to sign off on it with their license number. So the functional criteria will be completed by the Health Home Care Manager or CS. So you have gathered all the documentation and you have the determination of SED. You have the risk factors that they were recently in a higher level of placement or multi-system involved. You have an LPHA that has now signed off on the attestation form, and you have that documentation in the case record. And so you will proceed as you go into the UAS and you select the correct answers to target and risk. It will then allow you to get into the functional criteria, which is a subset of the CANS questions that will be outlined for you to be able to answer. If you already have a full valid CANS, completed CANS on the child already, you'll be able to link that existing CANS, and in the appendix, there is more information about that as well as in the UAS training. But I want to make sure that people understand that if you completed a CANS 4 months ago and you're now doing HCBS eligibility because there's a change in circumstance for the child or a significant change with them, then you may or may not want to link the CANS, because once you link the CANS, you cannot change the answers to the question. It's to save you time. So you want to make sure that the answers to the questions are what you want. This is very busy. But anyways, these are the questions, the different modules, and the questions for the 0 to 5, and the 6 to 21. So again, it's a subset. So in these modules, there's 1 or 2 or 3 or 4 of those answers that will be relevant to whether or not it meets the functional criteria for HCBS. So not the whole full CANS or an entire module, but a number of the items within a module. So that really concludes SED as the walkthrough. So you know what you would need to gather for the target population, for the risk factors, and then how you would proceed with the functional criteria. So we're going to do the same thing with the medically frail population. So again, the child needs to be under the age of 21, and then the child must have a documented physical disability. So you have 3 choices here of how you could pursue to receive or document the physical disability. I want to make sure that everybody is aware that right after we built the UAS and we did our webinar last March 13th, that these forms have changed. So I noted there that the LDSS 639 is now called the DOH 5144. So the form has changed, and so that you're aware, the OHIP 0005, 6, and 7 is now the DOH 5151, 5152, and 5153. On the next slide, I have provided, maybe another slide, I have provided the actual links, and those are on the DOH website, so they're easy to access for you. The definition of medically frail here, but as we mentioned, it's important for you to note that you only need to choose one of the protocols. So the first is that you have an SSI certification. So literally the child and family has gone through the SSI certification process through the Department of SSI, and they have an official certification that says they are physically disabled. The other process is the DOH, which is now called the DOH 5144, that used to be the LDSS 639. It is disability certification, or certificate, and this is a process where you have to complete forms that get reviewed here at DOH from an office, and the family is actually given a certificate that shows that they meet disability. And then the third process is these 3 forms that need to be completed by the appropriate professionals of each of these forms and the caregivers, and then has to be approved by an LPHA, so the licensed practitioner of the healing arts. So let's go through this very quickly here. So as I mentioned, SSI, that's the link to how to receive or go through that process through the Office of Temporary Disability Assistance, and how to obtain that certification. That is quite the process. I want to make sure people understand that we're not saying not to pursue this process, but it does take time. And under there is a couple bullets to show you, since you have to do an annual redetermination for a child before the age of 18, this usually has to be done every 3 years. And for adults, it can even go up to the years of 7 years. So you're going to need to see how long the SSI determination is for, because in an annual determination, you would already have the documentations. You would not have to go through the process again until the determination has expired. So it's important that you understand when the SSI certification is determined and how long it's good for. The same thing applies for the DOH 5144, the disability certificate. And usually that's a minimum of 12 months, but can be a maximum of 10 years. So once again, on your annual determinations, you want to know that if this is good for 3 years, then for the next 3 years, you don't need to get a new disability certificate or anything, that this would meet the requirement for HCBS eligibility. And then the last process that you could pursue, remember you only have to pursue one of these processes, is having these 3 forms completed. We denote here who needs to fill or complete the form. So the first one is by a physician, the second one is by a teacher, and the third one is from the parent guardian. If the child is not in school, then you would not fill out the 5152. If the child is school age and not in school, you will have to justify why that child's not in school. And again, these forms would have to be completed on a yearly basis. So if you're pursuing a new child that needs to meet this requirement, you may want to go through this third step here in completing these 3 forms, but then you could always complete the first or second step to have a longer determination of physically disabled, but you're getting the child to HCBS faster by doing these 3 forms, and then later not worrying about it on an annual determination if you get one of the other 2. So that's important to know. And again, all these forms need to be reviewed. These 3 forms need to be reviewed by the licensed practitioner of the healing arts. And we want to make sure that these forms you understand, as well as the SSI or the certificate, need to accompany the LPHA attestation. The things that are required in the target population need to be presented with the attestation, so the LPHA is actually reviewing the documentation and approving that they concur with what has been assessed. So it's important to know that you need to do these 3 forms, and they need to be reviewed by an LPHA. Well, the risk factor for MedFrag is the LPHA form, similar and the same as for SED. So you need someone within their scope of practice who can diagnose review the materials for MedFrag, so those 3 forms, and you only need to do it once, right? So you can have that same LPHA review those 3 forms and complete the attestation to be in compliance with meeting the target population and the risk factors. And there's the link to the LPHA form, as we mentioned with FED. It's the exact same form. It's broken down by target population, so the LPHA would only fill out the appropriate target population that they are reviewing for. So if you go through the SED door and you find the child is not eligible, and then you go through the MedFrag door, you would have to have a new LPHA form along with an appropriate LPHA form that would meet target population to be able to review the appropriate material. And then the functional criteria for the MedFrag would be completed by the Health Home Care Manager in CES. As you move forward, it's a subset of the CAMS questions. This is a little prettier, these boxes it shows. So if the child's 0 to 5 or 6 to 21, then these are the questions or the modules within the CAMS and the questions that are being asked. So that, again, you will be able to link your CAMS if you already have a full CAMS on the child, but you want to, once again, review your answers to those questions before you link something, because you want to make sure that it's reflective of the child's situation, because if you don't meet the functional criteria, but you met target or you met risk, does not mean that the child's automatically meeting HCBS LOC. You need all 3 to be able to meet HCBS eligibility. So I know this is a lot of information, but I hope it's helpful that it's broken down by target and the 3 steps that you need. And so we're going to talk quickly about the developmental disability and the MedFrag and the DD and foster care target population, because both of these are completed by the DDRO. It's incumbent upon the Health Home Care Manager in CES to gather the documentation and work with the family and providers to provide that information to the DDRO. And we're going to go through how you work together here. But the first thing I want to highlight is if you have a child that's in front of you that may be DD MedFrag, maybe they have a diagnosis, a developmental disability diagnosis, maybe you believe they might need DD and they have medical or complex medical needs, we are encouraging you to go and do the MedFrag target, risk, and functional prior to going to the DDRO. That will be a quicker process. The Health Home Care Manager and CES can conduct that process. So we are encouraging that you consider going through that door prior to sending the information to OPWDD. If the child is not found eligible for the children's waiver, but is believed to have a diagnosis of DD, then we need to refer to OPWDD anyways. We want to make sure that children who have developmental disabilities are served by the appropriate providers and the appropriate services. So a child who is not found eligible for the children's waiver, you want to refer them to OPWDD so they can be determined whether or not they meet the DD eligibility in the ICF level of care, and then they would be able to potentially get the OPWDD comprehensive waiver. If the child is found eligible for the children's waiver through the medically frail target population, then to ensure that the child has access to adult HCBS services through the OPWDD, comprehensive waiver, you still want to send that child at some point before their 21 birthday to OPWDD so that you can make transitional planning for them. So either way, if you believe that your child has DD, and we are encouraging you to go through the MedFrag HCBS LOC process to see if they're HCBS eligible, you still want to send them to OPWDD at some point. So if they're not eligible for the children's waiver, you probably want to send them over there immediately if you believe, or if they do have a diagnosis of DD. And if they are found eligible, you do want to talk with the family about getting them over to OPWDD so that they are prepared before they turn 21 to make some transitional services to potentially the OPWDD comprehensive waiver. So the DD MedFrag and foster care, as we already mentioned, will be completed only by the DDRO. So there should be no health home care managers or CS going through this door. There's nothing in the system to stop you, but you do have to get a slot from capacity management. So I want to make sure you all understand that if you go through this door and you go through this process without the DDRO, you will not be finding this child eligible and you will not be receiving a slot. So again, we encourage you for those DD MedFrag kids to go through the MedFrag door to try to expedite that process. Otherwise, for DD MedFrag and foster care, it needs to be conducted by the DDRO. And as our waiver outlines, you will need to meet those two things. And for the DD foster care, just remember that the child was currently in foster care or previously in foster care when they were receiving HCBS. So those children who were in the B2H waiver for foster care, and then they go home or they get adopted, if they continue to have HCBS services, they can continue to be determined eligible as long as there was no break in coverage or eligibility. The other thing is that the OPWDD DDROs will be conducting this HCBS LOC eligibility, the initial as well as the annual redetermination. So that it was not currently the status within B2H program. So that's important that these populations will always be done by the DDRO. And just so that you're aware, again, under the age of 21, and that they have to meet these conditions of the developmental disability, and it says right there, as defined by OPWDD. That's why it's important that OPWDD conducts this, that it's not just a diagnosis, but it's also regarding other factors like originates before the age of 22, is continued expectation that this will continue indefinitely. So there are processes that OPWDD needs to go through to make these determinations. There will be the health home care manager and CS will work with the family and other involved providers to gather the necessary documentation to refer the child to the DDRO and make that referral and have that communication with the DDRO if there's any other requirements or any other paperwork or information that they may need. So the health home care manager and CS will be the conduit between the family and the DDRO to ensure that the DDRO has the information they need to make that determination for HCBS. There is a form that the health home care manager or CS will need to complete. That's the link. It's a referral form that you'll need to complete. And as we mentioned in the previous slide, all the conditions that need to be met and the documentation that may need to be required. And the reason I kind of skipped over that a little bit is because you see this note at the bottom of the screen is that our OPWDD state partners and friends, along with OCFS, will be providing some specific concrete guidance to folks on how to get or obtain the information that's needed and how to get that to the DDROs. And we're going to have a specific either guidance or webinar about that because it's very specific. But for all of you to be aware is that all the care managers and CES staff need to make sure that in the HCS you download the secure file transfer. All the communication with the DDROs and with the capacity management team here at DOH will be through this secure file transfer. So please make sure this is the guidance document. I actually just did it last week. It literally took me 5 minutes. I mean, like once you remember your HCS password, it didn't take me that long. So you want to make sure that you have that. The Health Home Care Manager and CS will, again, collect the necessary documentation. They'll complete the referral form that's required by OPWDD. They will transfer all the documents. The DDROs will have access to the UAS tool for the assessment, and they'll be able to complete that. The DDROs will make sure that they have communication with the Health Home Care Manager or the CES staff, and then the Health Home Care Manager and CES staff will be able to go into the HCBS eligibility tool and see how it was completed and whether or not the child was found eligible, along with, of course, the communication with the DDRO. OPWDD has been working really hard at identifying who their children's liaison contacts are. And we have, again, put there that each region has their own mailbox, so we're trying to have a consistent pathway in which you'll just talk and share information and, you know, send the referral and the documents in a secure manner. Each region there outlines what counties they serve. So if you are working with a member in one of those counties, then you will know where you're going to send your information, and again, through that secure file transfer. So that is the way that OPWDD will be receiving these referrals and how they will be communicating with CES or the Health Home Care Manager regarding that particular child. So we want to just make sure that people understand you might have to just print this slide out and, you know, post it up, especially if you work with the medically frail population in DD, is that because we now have this Children's Consolidated Waiver and OPWDD has a comprehensive waiver, we want to make sure that families are really clear about what their options are. So we do have on our DOH website, and I believe OPWDD does also, a crosswalk of the services in their comprehensive waiver and their CCO health homes versus the children's waiver and the health homes serving children. And when you're also, you know, directing families where they should go. So if the child is found DD, so they meet the ICF, IDD eligibility and MedFrag, that means they are then going to be technically eligible, not technically, they are eligible for both the children's waiver and OPWDD comprehensive waiver. So again, the child and you should review and compare each of the waivers, and then the family gets to determine which waiver they want to be served in. If the child is found DD, ICF, IDD eligible, but not MedFrag, now you don't have to worry about this because the DDRO will be able to tell you, right, that they determine that the child meets ICF level of care, but not MedFrag, then that means they are not eligible for the children's waiver, but eligible for the OPWDD comprehensive waiver. If the child's already enrolled in Medicaid, then the child could go to the health home serving children. But again, you want to have that discussion with them, so they would need to meet the chronic conditions and appropriateness. But you really should have that discussion whether or not the family wants to go with health home serving children care management versus the OPWDD comprehensive waiver. And if the child is ineligible for DD and they are not med-frag, then they're not eligible for either of the children's waiver or OPWDD comprehensive waiver. If the child is in Medicaid, then again, if you want to see if they meet the chronic conditions and appropriateness for health home serving children, then there is the potential that they could receive health home care management services. So we wanted to make sure that we broke this down. Like I said, you might want to just print this out because there are still options for children and families if they meet pieces of the eligibility. And you want to make sure that they understand what they are eligible for or what they might be potentially eligible for, and that you can be able to explain this to them. Again, our DDROs from OPWDD will work with the health home care managers, and for CES, they will be making that ICF IDD eligibility determination as well as the med-frag for HCBS LOC, so they'll be able to give you this information so you can sit down with the family and walk them through these choices. We just want to remind folks that we did have a capacity management webinar, but we want to make sure that you all understand that any child that is determined HCBS eligible cannot start receiving HCBS services until they are given a slot. So the capacity management team, as we reported in our webinar, and the link is there, that on a daily business day at 4 o'clock, we will know any new child that is eligible, and we will be communicating through the secure file transfer with you and telling you whether or not you have a slot for little Johnny, whoever you assess, and being able to explain how that goes. And this is the way we will be managing slots as we move forward. For any child that is counted as a transitioning child, then those children already have a slot. So we are going to be wrapping up transitioning children here. The 26th, this Friday, is the last date to do anything. So please talk with your DOH liaisons. Your DOH liaisons should be talking with you and giving each of the former waiver providers their final list to say these are the kids that we are counting in the waiver. Any transitioning child that we confirm with you that was transitioned already has a slot. So you do not need to reach out to us to ask if they have a slot. You'll have a list of everyone that has a slot. And you do not need to do this HCBS eligibility the minute the portal is open tomorrow unless their annual redetermination is due for April or May. So that's really important because there was confusion in that first week that some providers thought they had to do a determination on all their transitioning kids. You do, but within the yearly determination window or due date. So a couple of last slides here is that each time you're working with a family and you're making an HCBS eligibility determination, remember we talked up front that you need to have that conversation with the family. They need to agree that you're going to pursue HCBS eligibility. You're going to document everything, all the paperwork and documentation you've collected in the case record. And each time you make that HCBS eligibility determination, then there will have to be a notice of decision that is sent to the family, articulating that whether or not they meet eligibility, okay? And also you will need to have the freedom of choice form signed. So when a child is determined HCBS eligible, you actually have to get it in writing that they have chose HCBS instead of an institutional or residential care. So remember what the purpose of HCBS is that you're trying to prevent them from going to a higher level of care, or you're trying to have them step down from a higher level of care. So they need to really choose HCBS. They also get to choose the services and the providers that will provide those services. They also get to choose each time that they want to continue, or they want to be with a health home, or they want to be with CES. So again, that form will have a help sheet attached that goes through assisting everyone. The link is there to that form. So we have here on this slide, we have the LPHA attestation form, which was linked in the slides above, the freedom of choice form, and then there's 2 notices of decision. These are still in draft, so we're hoping to have those out soon. They're going through their final processes, but those, the first one is for enrollment or denial of enrollment, and then the second one is for disenrollment or discontinuing into the waiver. Our friend here, Tanya, has reworked our website, and that's the link where all these forms would be found, as well as the 1915C waiver and other documents. All the DOH forms for the Med-Frag population are also on that website link. So maybe getting familiar with that. That also has the HCBS manual that will give you the list of all the services, how they are conducted, so you can be informed when you're working with a family and developing a plan of care. So I think we have a list of questions.
So hi, everyone. This is Ann Cuppinger from MCTAC. We've, kind of reached the specified time for the end of the webinar, but if Colette has a few minutes and wants to stay on, we can stick around for a few more minutes and handle a few questions. And I just want to reassure everyone that there will be a Q&A document that comes out and is posted on our website that will answer additional questions. And also in the slides later on, you'll see a reference to the email address that you can always send questions to for Health Home Serving Children, so that you can get your questions answered. But Colette, if you want to take a look and choose a few of the questions to answer, and folks are able to stick around, we can get to a couple.
Sure. So what happens if a health home youth comes to our program with Medicaid and then loses Medicaid while in the program? Would the care manager assist with getting Medicaid reactivated, or do they send them to CES? So it's always been the standard within the health home program that if a child loses their Medicaid, that you can continue to work with them to try to reestablish that Medicaid. You really should know when their recertification is due, so that you could be proactive. If for some reason they do lose their Medicaid, then you can continue to assist them to be reactivated. You would not send them to CES unless they were actually disenrolled from health home, from HCBS, because their Medicaid could not be reactivated, and at a later date, someone believed that they were HCBS eligible and they now no longer have Medicaid. Then that would be kind of like a new referral, and then they would go to CES. But it's hopeful that you would continue to assist them, and that is part of the role of a health home care manager. So there's a question about children who are enrolled, or health home enrolled members who are in foster care, and the foster care case planner should not try to apply for B2H services. That's correct. So B2H is no longer. That ended in March 31st. So you want to now apply for the new children's waiver, the HCBS eligibility. So if that child is potentially SED, Med-Frag, you as the health home care manager could pursue those. If that child is DD foster care, then that would go through OPWDD, the DDROs. So children who don't currently have a LOC, so children who were not in one of those 6 waivers and who did not transfer to CES or health home, and they are not counted as a transitioning child with a SLA according to your DOH liaison, would be considered a brand new kid to receive waiver services. And yes, you would do the HCBS LOC determination process to move forward in determining whether or not they're eligible. And then the second part of that question is, am I doing this so that they don't lose care management? So as we mentioned in the beginning, if you're HCBS eligible, you can receive health home care management, because when you have HCBS, you need some type of care coordination. So the family has a choice to have health home care management or to have CES. If you had a child that used to be in one of the 6 waivers and then for some reason was not counted as a transitioning child, or they didn't currently have an LOC or whatever it was, then you would need to go through the new HCBS LOC process, and we did outline the different conditions and what needed to happen in our emails based on whether or not the child was a transitioning kid or on the OMH wait list, etc. So somebody's asking about the exact role of the LPHA. So this is one of the first questions. So maybe we answered this, but as for the risk factors for Med-Frag and SED, there's an LPHA attestation, and there is directions there, but essentially you're going to provide all the documentation that shows you met the target population along with the attestation form, and the licensed practitioner of the healing art will review that, and within their scope of practice and their ability to diagnose, they are going to say whether or not they concur that the child meets the risk factors that without HCBS services, they would go to a higher placement, or they're in a higher placement and that HCBS would be helpful for them to return to the community. We always need to have the purpose of HCBS in the forefront of how we're moving forward. So what if a health home care manager is not taking referrals? So I would call your local health home, because each health home has a number of CMAs and a number of care management agencies. And remember now, we had about 61 providers or so with the 6 waivers. Now any health home care management agency can conduct the HCBS LOC. It's particularly important, though, that everybody remember that there has to be alignment between the provider and the child's condition. So we want those children who have, like SED, to be with providers that have experience, knowledge with working with that population. So even though any health home care management agency can conduct the eligibility determination, you really want to match the child's conditions with an appropriate providers. Health homes all have a policy on this, on how you do that. If you're not an approved provider for like SED, then you would have to refer that child back to the health home or to another provider that is equipped to serve that, that child. Do we need a release of information from the family to contact CES? Yes, absolutely you do. I mean, if the family gives you verbal permission to contact them, you won't be able to share any information. So you need to be able to share information with CS. So you need to get approval and consent to be able to talk to them. It's very important that if you have documentation, historical information of the family, that you don't want CS to start from scratch with the family, like no one ever knew that child. That could be very frustrating for the family. So you want to get that release, and you want to make sure that they can hit the ground running and working with that family to prove HCBS eligibility determination. So is there consent or permission to obtain completing the HCBS LOC in the UAS? So there's already consent forms, so please be aware that on the DOH Health Home Serving Children's website that there are already consent forms. So if the family signs they want to be enrolled in a health home, you already have that consent. There is a sharing of information consent form there. And there's also the functional consent, which is, I believe, the 5230, which gives you permission, the family is giving you permission to conduct the assessments within the UAS. On that form, it already mentions HCBS as well as a full CAN. So we were already planning for that. So those are the consents you need. You need to, again, document in the record that you've had that conversation with the family prior to conducting the assessment. And of course, signing the consent really helps that. And you'll have that in the record. And then after you're done the assessment and they're found eligible, then you're going to have to complete the freedom of choice consent that the family would also have to sign. So you have literally 3 pieces of documentation that the family has consented: the prior consent, the functional consent form signed, as well as the freedom of choice. So is a face-to-face required only for the initial eligibility or all the annuals? So it's each time you do the HCBS eligibility determination, it has to be face-to-face because, again, you have to get agreement that they want to move forward with HCBS. So a child could be HCBS eligible, receive services for a year, you visit the family, you say it's time for your redetermination, and they may now say they're no longer interested. So that is your face-to-face. You also want to make sure that you know any new updated information so that you can complete that eligibility determination correctly. So can the SED form be completed by DOH? So there's not an SED form, so I'm not sure about that question, but it's incumbent upon the health home care manager or CS to gather the proper documentation from the providers that are working with the child. So that's important. For those, we have 3 or 4 questions about the LPHA attestation, and I would just ask for you to, since we're almost out of time here, that you look at the form because it does give the list of who is an LPHA. It also gives directions, and as I said, if a help sheet or some other documents we can put out there to assist folks. So there's like 4 or 5 questions about OPWDD and the DDROs. So I'll just remind folks that we'll be announcing hopefully shortly some new guidance or additional guidance, I should say, and/or a webinar to just about that specific target populations because it's a little bit different where the DDROs are involved, and it's kind of involved. So we want to make sure you have the correct information in that. We clearly would have been squishing it in here since we're already running out of time. So we want to make sure that happens. So I just want to let you know, so before we close, so tomorrow we are having a TA call with our providers. We're going to be sending out the announcement, the TA call for tomorrow. The subject will be transitioning children, because there's 3 or 4 other questions here about LOC for transitioning kids and who's counted as a transitioning kid. So we are wrapping up who is a transitioning kid. So I will bring those questions to the call tomorrow that you have, and I will answer them on those calls. And as we said, we'll put out an FAQ. But it's important for everyone to know that a child is not considered a transitioning child unless you have verification from your DOH liaison, right? You would have had an active LOC from one of the 6 waivers, and if your annual redetermination for LOC was up between January and March 31st of 2019, you would have got a new LOC from one of the 6 waivers, and anything April 1st on that the annual determination was needed, you will be doing the new HCBS Eligibility Determination. For those of you who had it due in April, due to this the closure of the UAS and now the late refresher here, you have till the end of May to complete that. Any child that had an April redetermination that was due or May should be getting in that portal tomorrow when it opens, so that you can start that determination. Make sure you can go through the training if you haven't already, the online training. That's very important, and we'll be covering those questions tomorrow to make sure that everyone understands what's counted as a transitioning child, because Friday is the last due date for all the requirements that we had extended time throughout April. So we gave 4 more weeks to people, and we're kind of at the due date here. And then the last thing, remember, if you're doing the new HCBS eligibility determination for a transitioning kid and they are not found eligible through the new process, then we all need to talk before you tell the family that they're not eligible, right? Because of that slide, whatever, 4, I want to say. That process, okay? So I appreciate it, and I'm sorry we went over time.
No, Colette, and everyone on the webinar, thank you very much for your attention over the last couple of hours. We will be developing a Q&A document if your question wasn't answered, and we look forward to your participation in future webinars on related topics. So thank you very much, and I hope the rest of your day is enjoyable.